Well, working out, it's tough enough, right? But what makes it even more difficult is if you have a leaky bladder. But here's the deal, you're not alone. In fact, if you talk about it with your girlfriends, you may be surprised at how many women are affected. Dr. Russell Bartels from Scottsdale Center for Women's Health is here to explain how he can help you fix the leaks and what your options are. And, you know, a lot of women talk about it all the time over, you know, tea, margaritas, or whatever. They want to work out, but this is what happens. It's embarrassing.
It is, and they want solutions,
yes.
and they're not familiar with some of the newer solutions, and it's not, you know, bladder leaking is a huge problem, and it's not just women over 50 or 60 or 70, it's women in their 30s and 40s who are very active, and
is it a medical problem?
It is a medical problem, and it's usually the result of childbirth, but that's not the only scenario, but that's usually in the history of the patient is a baby or two, and it doesn't necessarily have to be a vaginal delivery, but it can be taken care of in a way that's pretty darn easy.
Really?
And women are familiar with that bladder sling, and they don't want that. They
because
don't want that
surgery, isn't it?
Right.
Yes.
And so oftentimes I'll ask the question, because a lot of women don't want to just bring that out and ask about it because it's embarrassing.
Right.
But so it's part of my job to ask the right questions, and they're happy I did open that door to the leaky bladder, and sometimes vaginal laxity goes along with that, and that's a whole nother topic, but the solutions can be the same. But the leaky bladder, and they don't want the surgery, they want non-invasive, easy fixes with no downtime, and over the years that's what we've come to be able to provide. And
you have lots of different options as well.
We have three main solutions that are non-surgical, One, which we've been doing for several years now, is called the FemiLift laser. It's 3 sessions, pretty quick, 5–10 minute sessions, about a month apart. We had some good results with that, but I felt like we could do better. So we added platelet-rich plasma, or the O shot as we call it, and that is an injection into the vagina, under the bladder. We can also use it to enhance sexual sensitivity, but this aids in continence as well, helps with that. Sometimes we'll do the FemiLift, sometimes we'll do the O shot, sometimes we'll combine those two.
I didn't know that the O shot did that all by itself too, though.
It can by itself. And then we have, most recently, and when I say most recently, about 1.5 years now, we've had the Genevieve radiofrequency device. So we have laser, PRP, radiofrequency, and the Genevieve is more of my workhorse now when it comes to vaginal laxity and stress incontinence, leaking when you cough or sneeze or exercise.
And what's different between that and the FemiLift?
Laser technology is a little more superficial in the vaginal skin, and the Genevieve radiofrequency goes deeper. And we get a better tightening, we get a better lifting of the bladder. So for patients who are struggling with incontinence, whether it's I leak when I exercise, and that's a huge problem. I have plenty of patients say that they don't want to go to the group exercise classes anymore because they're afraid they're going to leak.
And we want to exercise.
And we want to exercise. And so we have great solutions. Basically the Genevieve, it's a 20-minute, maybe 30-minute, non-painful, wide awake, no anesthesia needed, hop off the table and go about your business, and the results come in about 2 to 3 months, sometimes sooner though, but easy to do. Very easy, painless, and effective. All
right, well here's the good news. There are lots of options out there. Thank you for that, Dr. Bartels. And here is a special offer that Dr. Bartels has brought to you. He's offering up $500 off any non-surgical bladder treatment. As you heard, there are lots of options. Find out which one works best for you at Scottsdale Center for Women's Health at 8415 North Pima Road in Scottsdale, 480-425-8700. And you can learn more about your options at scottsdalewomenshealth.com.